when we're talking attacked by a swarm of bees, obviously if you've got a tiny Yorkie or you've got a Great Dane, that does make a difference. Anything under 14 stings per kilo, most animals will survive. Between 14 and 24 stings per kilo, very critical, and it could go either way. And if it's been more than 24 stings per kilo, that's unfortunately we can't save those animals.
Hey, I'm Dr. Carra, the host of the Paws Effect Podcast. This podcast is all about bridging the gap between pet owners and pet professionals, offering expert insights and sharing stories to help you better understand and care for your pets. Whether you're here to learn, to be inspired, or to simply feel more confident as a pet owner, you're in the right place. If you enjoy what you hear, please take a moment to subscribe, leave me a review, or share the episode with someone who could benefit. Your support helps this podcast grow and continue making a difference in the lives of pets and their people. Let's get to it. A very warm welcome back to the Paws Effect Podcast. I'm here with Dr. Nicky Hogan, and we are in our home, aren't we?
Yeah, it's very exciting. First one I've done that's been here, which is very cool.
Oh, it's a bit hot in here today. We were just
it
complaining,
is. But it's we'll survive.
Yeah. So this has come about because we actually discussed this case recently.
Yes.
And when I think back on this subject, I reflect on quite a severe case that you had not that long ago. That kind of sits in your memory, and you think about it when you're dealing with some of the more minor ones. And that is about what to do when your pet is stung by a bee.
Yeah.
But I think I want to go back a step. And yes, we are going to talk about bee stings, what to do, how to manage it, how serious it is, and get all your advice today. But what I want to start with is you don't always know what's happened.
Yeah, absolutely.
I think is that correct?
Absolutely. And I think it certainly seems to be more puppies. Puppies are generally sort of, if we're talking about a single bee sting, it's generally puppies. They're out in the garden, they're investigating, running through the bushes, and then you if you're out there with them, you might hear a little squeak. And then they come flying out of the bushes. And then in a couple of minutes, they've got a swelling wherever the sting is. Often it's on the muzzle because they're kind of digging around in the bushes. And then sometimes that's accompanied with swellings elsewhere. So commonly they get swelling around the eyes as well, and kind of the lips can puff up, even if they're not stung on the eye or the lips. And then you also get what we call urticaria, so little bumps all over the skin, kind of far away from where the original sting is, and the hair stands up, and they just look quite weird. So welts, what people would consider as welts in people. Yeah. And so a single bee sting is generally not a major issue. Hypothetically, you can potentially get animals that are highly allergic to bee stings like people. Having said that, I've never seen it.
No, I haven't either.
So, excuse me. It's possible, but it's certainly not something we see commonly. And your run-of-the-mill everyday puppy that comes in with a bee sting, we would generally give an antihistamine to and a corticosteroid injection, and that's kind of it, really. It's generally a non-event. But obviously each subsequent sting they have, potentially it could progress to the anaphylaxis type thing. But as I say, I haven't ever seen it.
So before we go into the treatment, because this is obviously, and this is something that a lot of owners ask us about, like, is it really necessary to come in? When we have that phone call, that initial, my dog's face, let's use the face, has suddenly swollen. They were fine. They were outside. They didn't see what happened. Often, so physiologically, if we can explain what happens in terms of that sudden onset swelling, that is not typically seen, for example, with a traumatic thing. Those kind of swellings you may occur over time with bleeding or hematomas.
Yeah.
But what is actually happening there?
Okay, so bee venom is actually quite complex. There's lots of different components to it. One of the main ones is something called melatonin. Then you get phospholipase A2 and apamin, and a bunch of different things. Also, amines, histamines, and those kinds of things get released. So the bee stings, and the protein is kind of presented to the body locally in that area, and that causes the host, the victim, to produce immunoglobulins, IgG type stuff, which then causes mast cells to degranulate. Basically what that means is that you just get the binding of this protein and it to a receptor, and it causes the cell to just release a lot of histamine, which is what causes the redness and the swelling and the itchiness and the pain and all of that kind of thing. So that's what happens kind of locally. And if it just stays local, you will just have that sort of local reaction. But as I say, sometimes you can get little bumps all over the body. That can happen. And then theoretically, if it kind of gets a step further, you can get things like hypersalivation, so drooling, vomiting, diarrhea. So I would certainly say if there's any vomiting or diarrhea, that needs to be brought in immediately, because it implies that we're kind of moving on to the next step of the inflammatory process. And also it depends on where they get stung. So if you've got a little dog that's been stung on the paw, yes, there's swelling, and the dog may not want to put weight on the foot, but it's not life-threatening. If they were catching flies and they actually caught a bee and the bee stung them at the back of the mouth, that's a different ballgame completely, because swelling on the foot is not really a major issue, but swelling at the back of the throat, it can compromise airways, and that's where it can become an emergency.
That's quite scary.
Yeah.
So you speak about obviously the swelling that occurs. From what you're saying, I'm understanding that if you get a swelling on, say, the distal limb or around the face, it can look visually quite scary, but this is not necessarily as serious as something that will then cause secondary issues like respiratory issues. So swallowing a bee, being stung at the back of the mouth, and those kind of signs are sometimes difficult to see because the swelling is internal.
Yeah,
so
absolutely.
What are the kind of things that generally present in those kind of cases? Let's say the worst case scenario, your dog has chewed a bee.
Look, I would say any sort of abnormal respiratory noises for your dog. I mean, there are certain breeds that are more prone to being noisy breathers, all your brachycephalics. So that does make it tricky. But I mean, most people know what the sort of resting state of their dog sounds like when they're breathing. So if there's any abnormal sounds, I would certainly say bring it straight in. Look, you don't want to get to the point where you look at their tongue and that's sort of going purplish, because then we're in severe trouble. So, we obviously want to see it before that. I have to say, though, the number of true life-threatening emergencies I've seen with bee stings, I've never had one bee sting cause me to really panic. The real issue is when you have a swarm of bees.
Okay, so let's talk about that in a second.
Okay.
So we speak about our brachycephalics, and what, for the listeners who don't own these short muzzled dogs or cats, the Persians and whatnot. What we're talking about here is that there is the same number of teeth, the same amount of soft tissue, but it's squished in a very small area. And so now having any additional swelling is going to compromise that airway even more.
Yeah,
is that correct?
Absolutely.
So one of the first signs that I saw, and a lot of people describe, especially when they send me a picture and say, "Oh, what do you think this is?" Which we get quite a lot of swellings, is that they are itchy.
Yes.
What is it, just for the listeners, obviously, what is it that makes it itchy? And why are they scratching at their faces or biting at their paws or whatever?
Well, again, it comes down to the histamine that's being released. So that causes all the swelling and the redness and so on. And it's extremely itchy and irritating for the animal. And so they'll be potentially pawing at their muzzle, or trying to rub their face on the on the ground, and then after a couple of minutes, you'll see sort of swelling around the eye or around the muzzle. And it's generally quite dramatic. And as you say, it's not a trauma-based thing. I mean, it literally comes up in a couple of minutes.
But they can cause more self-trauma. Have you seen those ones where they're
absolutely.
like scratching and
they start making like roasties on their faces and so on because they're trying to rub so much. Yeah.
Hi there, pet parents. This is Dr. Carra, the Ultra Pet Vet. I'm excited to introduce Ultra Pet's premium recipe for miniature and small breeds. Ultra Pet's smaller kibble size combined with calcium and phosphorus helps keep their teeth in tip-top shape. We've added omega-3 to support their heart function while keeping your little one strong and healthy. Ultra Pet has included chondroitin, glucosamine, and green lip mussel extract to help your dog's joints and L-carnitine to manage weight. Prebiotics play a crucial role in maintaining a healthy digestive system by nourishing the good bacteria in your dog's gut. The best part? Ultra Pet offers a 100% money-back guarantee. Visit your local vet or pet store to make the switch now. We're going to talk about the swarms because that's the case example I was alluding to as we started, which I'm sure you're aware. But these bee stings generally can be self-limiting, can't they? So what absolutely. I mean by that is, sometimes people can get away with not having to visit their vet. How can owners manage at home without risking their pets, and where do they draw the line in terms of going, I actually need to see a vet? Or should all cases come via us so that we can reduce the discomfort? Because before you answer that, I don't know if any of the listeners have recently been stung by a bee. But you know why children cry when, as an adult, you are stung by a bee? Because it is really sore.
Really sore, yeah.
I was stung as an adult not that long ago, and I was blown away.
You've forgotten how sore it was.
It's really, really painful.
Yeah, it is.
Hey?
Absolutely.
So, it's not surprising that our kids go, children cry, and that our dogs show this level of discomfort. Is it acceptable, therefore, to say, don't worry, just manage it at home, or just leave them?
Look, I think it also depends on how easy access you have to veterinary care. If you're stuck on a farm in the middle of nowhere, then keep some antihistamines at home. Some allergics or something goes down really well, and that will help with the to prevent any further swelling and irritation. But it won't deal with what's already there. The body will have to kind of naturally break that down. So that will take longer, but it will eventually go away. So certainly if, say it's on a leg and the dog is kind of uncomfortable, but still walking around and still wants to eat its food and do all of that kind of thing, then by all means, give it some antihistamine. And if you've got any cortisone-based cream at home, you can kind of rub that on the area, and that will certainly help. Any sort of change in alertness, so if they become sort of lethargic or a bit dull, or any change in the breathing or the vomiting and the diarrhea, that definitely has to be brought straight in.
So what's happening there?
Well, it's just part of there's the apomin, which is the neurotoxic part of the bee sting. That again, I've only really seen with the swarm side of things. But those cases when there has been enough toxin, they can become what we call ataxic. So they kind of fall over. They are very reduced mental alertness, so a variety of neurological symptoms. But yeah, as I say, that's kind of only in the swarm side of things. But the histamine that's released causes a number of issues, obviously locally and then further afield. And I mean, you can get vasodilation, and so the animal may appear pale. The difficulty breathing, that's normally what we see in like an anaphylactic type reaction, which we see more in people. But theoretically that could happen and it become difficult for the animal to breathe, and so pale gums and sort of very noisy, difficulty kind of breathing sound. But I haven't actually come across that yet, luckily.
So how serious is it because I know we're talking one extreme, one bee sting versus we're going to talk about swarms. people often don't know how many stings their pets have had, particularly if they're long-coated or they haven't been home or the animal comes into the house and in that you can't necessarily tell how many bees have stung them. But how serious is it if you receive multiple bee stings over a period of time? So say they were stung 2 weeks ago, now they're stung again. Is there a cumulative effect of it? Do you see them reacting more, or do they become better at managing bee stings the more they're stung?
So theoretically, each time they're stung, the first time they're stung, that now becomes a sensitized individual. So each time they're stung, it can potentially get worse and worse. And that's certainly what people with bee allergies have, is that sort of hypersensitivity. And yeah, I haven't seen any that have kind of been stung over a period of a few weeks. Yes, luckily, most of the time. But yeah, theoretically, they could become hypersensitized to the whole thing, and each reaction could get worse and worse.
Okay. So let's go into the discussion of a swarm of bees and your poor pet. It's not usually the cats, it's usually the dogs.
Yeah.
They're going to disturb a hive and, they're just none the wiser until they've been stung multiple times. What happens there, and why is that really, really serious, and why should owners be very proactive?
So I want to just kind of take a step back a little bit and kind of go to where the whole swarm thing comes from.
Okay.
Because most beehives are in sort of out-of-the-way places and won't necessarily be somewhere where a dog can kind of get to. But part of the whole, it's a natural life progression of the bee where at some point the hive will get too small for its inhabitants, basically. And so they will then kind of divide. Okay. And you'll get like the old queen and some of the workers moving off, and they'll kind of stay close to the original hive, about 20, 30 meters, and they'll just conglomerate on something. I mean, it might be a tree stump or whatever, which would be a lot more accessible to a pet. And they're actually, once they're in that swarm, they're not particularly dangerous because they tend to have a big belly full of honey before they leave to kind of prepare for moving to the next place. And from that swarm of where they're just conglomerating on something, they will have scouts that go out to go and look for a new home. And when they're just sitting there, they're not aggressive because they are not protecting the queen. They're not protecting resources or anything, and so they'll just sit there. But obviously, they're a lot more accessible, and I think that's when this incident really happens, is when they're out of the hive and they're just kind of waiting around. And I think that's when it happens. And this normally happens like sort of spring going into early summer. So if you see anything like that, certainly if you see a hive dividing, make sure the pets are inside and try and get one of the beekeepers to come and collect them, because they do actually move them on. But I think what happens is, two dogs playing outside and they tearing around and they could bump into this swarm, and then that's when things go pear-shaped.
So we have a hive at home. And one of the things I know the bees hate, firstly, when you send the dog in there with the ball by mistake and they knock them, that's obviously try and keep it in a place where your dogs are not going to have access. Like you say, most people are sensible. But it's sometimes machinery like, lawnmowers,
weed eaters,
things that disturb them, that kind of frequency of sound or something that seems to get them going.
Yeah.
And often it's not necessarily that the dogs are just happen to be there.
Wrong place, wrong time stuff.
Yeah.
Absolutely.
And that's where I often see the risk, and I'm now, wiser to it, that I go, okay, well, if we're cutting the grass, the dogs are going to be kept on the other side of the garden or inside or whatever.
Yeah, absolutely.
But you learn sometimes the hard way, and I think that is the thing that you don't ever want any owners to have to experience what we've witnessed within this practice, and that is the swarm. So if you're ready to tell us about that and what happens, that would be great.
Yeah, so it is it's an awful thing to have to try and treat, because you're already so far on the back foot, because it depends on how far the people have had to travel to get them animals in. And it's all based on, so this is very different to the allergic type reaction that happens with a single bee sting. So when we're talking attacked by a swarm of bees, it's purely cumulative. So it's all those little stingers that have been injected into the animal. It's cumulative of the actual toxin itself. It's got nothing to do with the animal's immune system.
Okay.
And
it's like the dose.
Exactly.
Dose they've received.
Dose dependent. So obviously if you've got a tiny Yorkie or you've got a Great Dane, that does make a difference, because they've actually kind of worked out the sort of ceiling, as it were, of where you're going to be okay and where you're not going to be okay.
So a bit like a chocolate toxicity.
Exactly. So anything under 14 stings per kilo, most animals will survive. Between 14 and 24 stings per kilo, very critical, and it could go either way. And if it's been more than 24 stings per kilo, that's unfortunately we can't save those animals.
And I suppose that makes a difference, and sorry to interrupt you, because it also allows us to manage owners' expectations.
Absolutely.
If you get in this and you can count the stings, and I'm sure you'll go into like what you actively do when you receive these patients, but it can also, from our experience and from knowing about the ceiling, like you say, of saying, this is not going to turn out the way we want. So emotionally, financially, sort of the whole investment in this, I've got to manage your expectations. Do you want us to go ahead?
Yeah.
So let's assume our case example, like we received, owners, they rush their animals in. What happened with that case?
So there were 2 dogs involved, and in fact, the one that they brought both dogs in, but not because they thought both dogs had been stung. So they brought both dogs in, and the Jack Russell was really in such a terrible way. I mean, it was already neurological. It was hypoxic. So gums and tongue were purple, and there was the vomiting and the diarrhea, and eventually becomes bloody. So you can get like a bloody diarrhea. So that's the one that was obviously kind of, we were focusing all our attention on initially. And we have to, straight away put those animals on shock rate fluids, because it causes massive vasodilation. So all the blood vessels dilate. And so they become hypertensive. So, and you don't get proper blood flow to all organs. So put them on fluids, give them IV corticosteroids. We give them antihistamines. We, in some cases, would need to give them adrenaline, a variety of different things. And I actually went to go chat to, because I noticed they were in reception and holding another little dog. And I was like, okay, and this dog, no, she wasn't there. And I was like, are you sure? No, we're fairly sure. And she still looked pretty bright. And I said, do you mind if I just have a look? And she was a little sort of long-haired Yorkie type breed. Excuse me. And took her to the prep room and started having a look. And there were lots and lots of stingers in this little one. So I was very grateful that they'd brought her in as well, because if they hadn't, they probably would have gotten home, and that would be the end of that little dog, because they lived out on a farm. So, after working on the Jack Russell, we kind of had the conversation and said, look, we are in serious trouble here, and we can try, but we can't make any promises, and there are a lot of stingers here. And so, in fact, they opted to euthanize that case, that little pet, shame. And she was also a lot older as well. And then we focused our attention on the small little one. And she ended up surviving, which is great. But it was touch and go, because they weren't even aware that she had been part of the whole ruckus that went on outside.
And it's one of those cases that gives me goosebumps just thinking back to it. It was
absolutely
incredible that you spotted that.
So that was very lucky. But yeah, they have to be treated aggressively with fluids and, steroids and so on. And there's lots of parameters that we have to monitor. So treating the initial sort of shock episode is not it, unfortunately. So you can kind of get them out of that shock state and kind of get them onto better footing, but they can have all sorts of sort of complications as a result of it. So one of which, the most common, is acute kidney failure, because the combination of these toxins together forms something called B hemolytic factor. And what it does is it basically splits cells in the cell membranes. And one of the most common ones is red blood cells, and then also muscle cells. So what happens with the acute kidney injury is that all these muscle cells start breaking down, and then that pigment, that myoglobin, goes and sits in the kidney, and it gets crystallized in the kidney, and then the kidneys just stop working. So keeping an eye on urine output is extremely important in these cases. You're pumping them full of fluids, and you need to make sure that kind of what's going in is coming out. So we need to keep a very close eye on that. And then you can get secondary liver damage. You can get one of the more common things is, and this can happen a week or so later, they can develop an anemia that happens not just from the red cells lysing, but then the animal's own immune system gets involved and goes into overdrive, and they can develop a condition called immune-mediated hemolytic anemia. So we see IMHA very frequently with tick bite fever, and it's something we're used to treating. But it does involve a lot of treatment, and it can go sideways on you quite quickly. So, and luckily we're used to treating it with the tick bite fever.
You know what to look out for.
Exactly. So you need to monitor things like what the red blood cells are looking like on blood smears, keep an eye on the red cell count, all that kind of thing.
And owners may see this as bloody urine or blood in the stools, but often by that point it's too late.
Yeah.
Isn't it?
And so the important thing for I think, to the point I want to drive home, is that often people, if we manage to save them from the initial shock episode, then the owner's like, okay, great, let's take them home. And we really cannot send them home. I mean, a lot of these cases need to be hospitalized for like 2 weeks to monitor all of those parameters and make sure they don't develop any secondary complications.
Very much so. And I think, managing expectations in terms of the costs involved of that intensive care, whether it's repeating bloods or supporting nutrition, or like if that has to be done in order to try and support what is now a very compromised immune system, and it affects multiple organs.
Absolutely.
As you explained. So bee stings can be from mild to very serious. And I think the reason why I find this quite important but interesting topic is that often people just don't know that in between, which is why I'm slightly very cautious about advising owners with, that WhatsApp photo that comes up on your phone.
Yeah.
Like, oh, my animal's just been stung by a bee. I'm like, oh, is it one? Is it one? If it's one, you can try, but if it doesn't, just because we, especially working in a practice that sees a lot of emergencies, we've seen the others, the worst case scenario. And so I think it sets you up to.
I think I was talking about, treating at home, and yes, hypothetically that is possible, but I'm always an overly cautious person, so I would much rather see an animal, because yes, you can get a photo, but you don't, you can't listen to its heart rate, you can't see its gum color and refill time and all that kind of thing on a photo. I would much rather have the animal in with me so I can examine all of its parameters and see if they're normal or not. And you can often kind of get a feel for the ones that you need to watch. Yeah. And then you say, okay, well, we can do this. I'll give you give the animal the injections, and then some of them I'll say, okay, off you go, or go home, everything will be fine. And the others I'll say, I'm going to treat it like this, but I'd like to hang onto your little dog and monitor it here and make sure things don't get worse from there.
So one of the questions I had that I thought definitely need to ask you about this is, so you talk about stinging, you talk about seeing visually, you know what to look for, obviously. Can owners do damage by then handling their pets once they've been stung? Can you press, can those little sacs that are sort of inserted into the skin, can they still contain some
Make
of
it worse?
Yeah.
Hypothetically, there could be a fractional amount in there, but as a rule, within 60 seconds of being stung, that saccule is empty.
Okay.
So, going there and fiddling around with it.
So there's no benefit in removing those?
No, there really isn't.
That's one of the questions owners were asking.
Other than sometimes, I have had a couple of puppies with, like, say, a stinger on the inside of the lip, and the actual physical irritation of it, that would be helpful to remove, but it's not going to change how much toxin is injected into the animal at all.
That's useful information. So I know we don't want to, we try and avoid talking about the actual particular drugs, but we can maybe talk about dosages of antihistamines. So if owners have this at home and they say, okay, I can't get in, I can't afford it, you're too far, whatever, and we're advising with caution, what can they administer and how much? Is it size dependent in terms of the size of the animal, or are we talking?
It is kind of size dependent to a degree. I think it's safe to say that most South Africans will have allergies in their medicine cabinet for themselves or kids or whatever. So that's the one that we would routinely use, the oral one.
4 milligram tablet.
Exactly, 4 milligram tablet. If it is a really tiny Yorkie or Min Pin, I would probably go half a tablet. If it's a massive Great Dane, I would say at least 2, maybe 3 tablets. It's very much a kind of thumb suck, though. There isn't a specific dose. But that, as I say, that will help with preventing any further swelling. But the existing swelling you're seeing, that the antihistamine you give is not going to have any effect on that.
Although I do like the antihistamines that cause a bit of drowsiness. And I often like people say, well, what should I look out for? I'm like, well, hopefully they'll settle down and hopefully this will make them slightly drowsy, because then they do less damage and they're less irritated and sore.
Exactly.
So, and things like cold compress, can you advise owners just to try and help soothe?
You could do that, but if you're not giving any sort of cortisone with the antihistamine, you can kind of delay the swelling coming down, because you obviously need the area needs blood flow for the body to kind of get rid of all the toxins and the metabolites and so on. So if you're putting a cold compress on there, you're going to cause vasoconstriction and it might delay. It might feel good at the time, and certainly if they're kind of trying to rip themselves open, it would certainly be worthwhile. It might just take longer for the whole thing to disappear in the end.
So what you're saying is, obviously with the vasodilation, it's allowing the blood to supply that area with the things it needs in order to then manage this insult.
Exactly, and then deal with it and get rid of it.
And remove it from its location. It's fascinating. So take-home message for owners: if you think your pet has been stung, and I know we've spoken about dogs, and we've done that in particular because we see more dog cases. But I've seen cats. I mean, my cats chase bees.
I would say maybe on a paw, like when they're trying to swat it.
They very rarely take it in their mouth.
Yeah, I've never had a cat with something. I think in almost 20 years I might have had one cat that stung by a bee.
Yeah,
like they're just generally smarter.
So take home message for those dog owners whose pets, and we've got to say, like you said before, typical presenting case is the young dog.
Yeah, absolutely.
And they do learn, and we were talking off air earlier about learning through suffering and pain and things. It's a learning process. Like a lot of us make changes and learn through mistakes
Yes.
and real discomfort. It's often what makes people shift to do something. And these dogs are learning.
Absolutely.
And they don't tend to repeat their behavior. Obviously, they can't control necessary swarms.
Yeah.
But, you don't go and play with insects so much when you've been hurt by the
stung
last
once,
one.
then they realize this is not a toy.
Cool. Yeah. So it's the young one. So what would your take-home message be if you think your pet's been stung by a bee, or you know that they've been stung by a bee?
If it's possible, I would bring them in just so that we can have a look, make sure that everything's fine. And it's generally a case of 2 injections and off they go, and they're a lot happier and they're a lot more comfortable, and the swelling goes down over the course of the next sort of half an hour, and they're kind of back to normal. So if possible, rather bring them in so we can check them over. If not, then by all means do the allergies at home.
And contact your vet, I suppose, hey?
Yeah.
Like at least then you can say, is this normal? Like, is the swelling still meant to be here?
Yes.
They're salivating now. Is this kind of,
Yes.
all those sort of signs that owners don't know whether this is now progression or just part of the process. So
Yeah, exactly.
There are enough emergency practices out there who are happy to support
just
you through
at
it.
least give you some advice, absolutely, even if you can't bring them in.
Definitely. Thank you. It was really interesting, great conversation.
You're
as
welcome.
always.
Thank you
Dr.
for
Nicky Hogan.
Thank you for having me.
Oh, I always love it.
Always good to have a proper chat.
Yes. Thanks again.
Thanks.
Thank you so much for tuning into today's episode on the Paws Effect podcast. If you found the discussion helpful, please like, share, and follow our podcasts. Don't forget to leave us a comment or review. We love hearing from our listeners. Remember, you can listen to us on your preferred podcast platform. Welcome back to Just for Pets. You're with Dr. Carra.
Hello, Doctor. It's Chanel the Persian. And, I can't seem to stop retching to get this hairball up.
Are you on a special diet?
Excuse me?
Hairball control food will really help. And maybe some Laxapet. And lucky for you, Just for Pets have a big range.
Well, how early can I get some?
Order today and we'll deliver pronto.
Wow, I feel better already.
Justforpets.co.za. Vet approved, pet adored. Get it all to your door.